Good evening, everyone, and welcome to tonight's Men's Health webinar. Tonight is a bit of a treat. We've got the opportunity to hear from two wonderful doctors at the Urology St. Louis practice, and they will present on life after prostate cancer, and specifically talk about the signs, symptoms, and treatment options for two common side effects of prostate cancer treatment: erectile dysfunction and stress urinary incontinence. So during this presentation, I encourage and invite all of you to ask questions. If you move your mouse on your laptop, touch the screen of your mobile device, a toolbar will pop up. You will see a tool that says chat. Click on that, type your question in, hit submit, and we will get to those questions at the conclusion of the presentation. So starting off our presentation, we have Dr. So I'm going to hack that. I apologize. Dr. Zaid, who will be followed by Dr. Majdi Islam. I would like to introduce both doctors. Dr. Zaid.
Yep. Hi, good evening. Thank you for joining us. I'm Dr. Zaid. I'm a urologist here at the Urology of St. Louis group in the St. Louis metropolitan area. I did a fellowship in reconstructive urology at the Duke University, but I'm originally from California. I went to school at UCLA and then did my residency up in San Francisco. So kind of a transplant to the Midwest here, but nonetheless, still really passionate about male urinary health and a lot of cancer survivorship issues as well.
And my name's Majdi Islam. I am one of Dr. Weiss's partners. I'm also at Urology of St. Louis. I actually did my school right here in town. I was born and raised in St. Louis, went to Mizzou for undergrad, med school, did my residency in Colorado, and then I did my fellowship at UCLA. So Weiss and I kind of traded places and then moved back home. And I specialize in men's health and did a fellowship in men's health, which entails erectile dysfunction, as well as Peyronie's disease, penile curvature, male fertility and infertility, and do vasectomy reversals.
Wonderful. Well, between Dr. Islam and myself, we do cover a lot of the gamut of male health, both on the cancer survivorship issues and the non-cancer survivorship issues as well. So I do feel we have a lot to offer. Obviously, the slides here, we want to avoid people recording this just so we can kind of have a nice candid conversation and open dialogue. We're talking about a lot of issues that people don't feel comfortable kind of talking about, and, just kind of keeps it as a nice open environment for everybody as well. So starting off with prostate cancer, statistically, odds are we're going to know somebody with prostate cancer. 1 in 9 men are going to develop prostate cancer. It's the most common non-skin cancer in American men. It's also a leading cause of cancer mortality in American and men as well. And, the thing with prostate cancer is there's a lot of cancer survivors. It's actually kind of one of the miracles of cancer management. We can cure prostate cancer. But of course, with any cure, there do come a lot of side effects. And we have a lot of people who are cancer survivors with a lot of cancer survivorship issues. So nearly 3 million men in the United States are survivors of cancer of the prostate as well. But as a result, they have a lot of issues that we do see from that do significantly impact quality of life. Today, we're going to kind of specifically address 2 major issues that we find in our practice: erectile dysfunction and urinary leakage after prostate cancer treatment. And that's just not surgical treatment. That could be after radiation treatment as well too. So we see a lot of these. So I'm going to kind of take the helm here and start talking about incontinence, and then Dr. Islam will kind of talk about the erectile dysfunction component of things here as well. So urinary leakage, in essence, is basically the involuntary loss of urine as well. We hear a lot about it. You hear about people having accidents. When you go down the aisles at Walmart or Walgreens, those aisles are just full of pads. It's a huge problem, and it's a huge industry as well. Particularly after prostate cancer, men can leak in varying degrees. Some men just leak a few drops, but some men just, they pour urine and they go through pads and diapers and they get saturated. It's a major issue from a quality of life perspective. You can't be socially active. You can't be sexually active. You can end up just being stuck at home because you worry about accidents. You can't wear light pants because you're worried about saturation. It also adds up really fast because those pads are pretty expensive. Then you start seeing some sequelae like, fungal infections in the skin and just other wound breakdown and skin breakdown and things of that nature. Usually the leakage is pretty pronounced immediately after surgery and it improves over the course of the first few weeks to months. And by about a year, most men are going to kind of stabilize with regards to their urinary control. So I tell guys to kind of expect to see the final result by about a year or so after surgery in particular. Radiation is a little different where it tends to get worse as time progresses as well. And when it comes to leakage, there are two different types of leakage. There's urge leakage, which is the type of leakage you have since you don't get to the bathroom in time. And there's stress leakage, which is coughing, laughing, sneezing leakage. And I'm going to kind of focus more on the stress leakage today here. So the varying degrees, and you talk to 10 surgeons, they'll give you 10 different numbers, but on average is about like an 8 to 12% rates of significant stress incontinence after a prostatectomy. However, a subset of these men are going to just be completely saturated as well. The key thing is we treated a lot of men with prostate cancer, and a lot of them have these survivorship issues, and a lot of men don't realize there actually are wonderful options. And if people are bothered by leakage, there are just great ways to help with that. And I think that's the most important thing. This is a conversation driven by the patient and their partner with regards to the different treatment options. Some men, they leak a light pad, they're horribly devastated. Some men leak a diapers and they're not bothered. It really is a patient-centric decision. And that's kind of our goal, is to just kind of go over the options, and the patient decides for themselves as well. So there's a whole gamut of options on how you treat leakage. You start with the less invasive options. You can use pads, you can use adult diapers, and they can get really expensive. I think there was a study that showed that a year of leakage can almost add up to the cost of like an implant device, actually. So it's pretty quick. You're amazed how quickly these things add up. You can wear an external collection device called a condom catheter. Those don't always work so great. They usually slide off, and they get messy at nighttime, especially. There's a clamp called a Cunningham clamp that you can put on the outside of the penis. It's kind of an okay option, but you really can't keep it on the whole day because it can lead to other trauma to the penile tissues as well. And then, of course, especially in the first year, I am a proponent of physical therapy and physical exercises. That's where you kind of strengthen those pelvic muscles to kind of give the pelvic floor strength as well. Usually after about a year, you start seeing limited benefits from physical therapy and Kegels, but it still does play an important role both for for urinary and sexual function as well. Oftentimes when I'm seeing men, they've kind of gone through these like less invasive options, and now they're having moderate to higher volume leakage. And again, it's a decision we make together with regards to the number of pads they use, how saturated they get, how much they leak, what triggers their leakage, as well. But there are good options. And these are the more invasive options. Some, urologists will kind of talk about injection agents. You can actually put stuff in the urethra. It's less invasive. But really, in my experience, it just doesn't work so great. If it does work, it's transient, and it usually doesn't get patients to their goal. So then there are actually better surgical options. The first is something called a male urethral sling. It's actually a little mesh hammock you put under the urethra that kind of supports the urethra. The really neat thing about the sling is once you put it in, it's actually working immediately. There's no need to push any buttons or anything, and it kind of just helps, and it stays in place as well. Now, a lot of patients ask, well, it's mesh. I've heard scary things about mesh. Do I need to be really worried about it? Well, mesh is a permanent part of your body, but that's kind of what gives the device its strength. A lot of the scary stuff also is seen in the female patients when the tissues aren't as robust. In male patients, there certainly are always risks of complications, but it's a lot lower as well. This device is great for helping men when they leak, when they cough, laugh, or sneeze as well. And I find the mesh works quite well in men with medium to lower volume leakage, but it's a good option as well. It's a surgery. It's an outpatient surgery. You should be able to go home the same day. We make an incision in the bicyclosid area and 2 little pokes in the groin area and as well. Now, a lot of times we'll see men with really high volume leakage. These are the men who are wearing big diapers and pads, and they're saturating them. And, you examine them in the clinic and they have a big gush of urine with even the lightest of coughs, or in men who've had pretty significant radiation combined with surgery. For these men, I often find that an artificial sphincter is actually a great option for them. So an artificial sphincter is a really neat device. It's been around for over 25 years. It's made in Minnesota. It's handmade. And, I've been out to the factory where they make it, and they just do an amazing job out there. But the sphincter is basically a 3-piece device. So when you look at the anatomy over here, I'm not sure if you can see my mouse here, but you see the bladder right there. Then you got your penis right there, and there's this channel called the urethra tube that runs all the way through the penis right there. Normally, your normal spigot valve, your sphincter, sits right there, and that's where the prostate was sitting. Well, as a result of surgery or whatever have you, that sphincter valve doesn't work so well. So then what we do is a surgery where we actually put a sphincter around the urethra, and what it's doing at baseline is actually squeezing the urethra shut. when you want to urinate, you give that pump a nice little squeeze and it opens up the device, and it basically just transfers fluid back and forth. It's a really neat hydraulic device. And when the device opens up, you just pass urine like you normally do. Then over the next like 1 to 3 minutes or so, the device automatically closes back up on its own, which is really neat. So all you have to do is push the button when you want to urinate as well. It's actually a really neat device. It actually mimics the male's normal urethra as well. Of course, it does have a few little moving parts, but it does have a lifetime, as well, as opposed to the sling, which is kind of a one and done type thing. This actually does require revisions down the road if there is going to be down the road, usually about like 5 to 7 years on average. But it does a really nice job keeping somebody drier, especially for our guys who have higher volume leakage. I find that our sphincter guys are some of the happiest guys you'll meet. It's literally like a switch turns on as well. So it's a cool device. There are some wonderful resources. Fixincontinence.com. Actually, I was on that website a little earlier. There's a really neat quiz there that kind of gives you, it asks you different questions. You can kind of parse out the different types of leakages. Again, not all leakage is the same. I kind of alluded to this earlier. There's a stress versus an urge leakage and things of that nature as well. But it's a great resource. It's got some good information on it as well too. And things that help us when we're trying to figure out what to do for somebody is the number of pads they use, what triggers the leakage, what makes it worse, what makes it better. So those are all good things that, we like to know as well. But that's kind of the upshot on urinary leakage. But I'm going to turn the baton over to Dr. Islam, and he's going to talk about sexual health.
Perfect. Dr. Weiss, that was riveting. As an expert in urinary continence and urinary health in general, it's great having a partner like Dr. Zaid to be around to partner with, to deal with both of these sequelae of prostate cancer. So that being said, I'm going to talk a little bit about sexual health and erectile function. The important thing with erectile dysfunction, after prostate cancer procedures or treatments, they can affect essentially the nerves that run right next to the prostate. Those nerves control erectile function. And so whenever a guy goes through a prostate cancer surgery, so the prostatectomy, those nerves, usually we try to preserve or do what's called a nerve sparing technique. The issue is, despite even preserving those nerves, just a little bit of that manipulation to those nerves can cause guys to have issues or with erectile function, or their erectile function just takes a bit of a hit. And sometimes it can take even up to 1.5 years or so to regain that function, that sexual function, to regain your erections. The best predictor for regaining that function usually is how well a man's erectile function was preoperatively prior to that surgery. But that being said, even guys that had great erectile function preoperatively can either have a procedure that went well, that just for whatever reason the nerves don't want to regenerate or regrow, or that they had to have a procedure that was not nerve sparing because the cancer got into or close to those nerves. And so there's things that we can do to try and improve that erectile function, something that we call prehab or penile rehabilitation. Penile rehabilitation, things like taking medications, doing other things to try and help accelerate that healing process. But that being said, after a certain amount of time, it can be you can only get a certain amount of regeneration back. And so we've got some treatment options usually on this next slide that we will offer to patients that not only have a erectile dysfunction after prostate cancer, but also just in general after having erectile dysfunction from things like diabetes, hypertension, hyperlipidemia, high blood pressure, high cholesterol, et cetera. Well, the option that most guys have heard of, or at least that have done, is basically oral medication. So things like Cialis, Viagra, et cetera. It brings in blood flow to the penis. It tries to not only give a guy an erection by bringing blood flow to the penis at that specific time after taking the medication, but also oftentimes we'll give guys oral medications like Cialis at a lower dose daily to allow for bringing in a little bit of blood flow to the penis, but also to allow blood flow and inflammatory products to go to those nerves to try and speed up that healing process. The other thing I often will recommend is a vacuum erection device, or a vacuum pump. It's basically literally just it's a penis pump essentially. Put a cylinder on top of the penis, it creates a vacuum, brings in blood flow to the penis to allow for flow, and ideally for some erectile function. Oftentimes there's a constriction band, or a little band that one places at the base of the penis to keep the flow into the penis. The issue is, oftentimes there's a lot of guys that, despite these non-invasive treatment options, have trouble with maintaining erectile function, maintaining rigidity, or just being able to get an erection at all. And so the more invasive options are things like urethral suppositories, taking a little suppository or a pill and placing it into the P channel. I found that a lot of guys have some difficulty with doing this just because it's a little bit of an uncomfortable thing to do, but also about 15% of men will have urethral burning, or basically a little bit of burning in the P channel when the medication goes in. And only about 60% of guys actually have a successful rigid erection for satisfactory for intercourse after this. It's a step that most guys, in my experience, don't stick with for very long. Penile injections, or injections into the side of the penis, can help provide erectile function. So basically, the injection is a liquid form of medication that induces blood flow or dilation of the arteries in the penis. The positive is it works about 80 to 90% of the time. The reason is because there's different concentrations of the medication, and you can place a different amount of the medication into the penis. The only issue is, of course, it's a needle, and taking a needle and injecting the side of the penis. And so putting a needle into the side of the penis isn't always the most attractive option. But B, there are some patients that either it doesn't work as well on, or that it doesn't give them the erection that's satisfactory to their potential needs. And the last option is, penile implant. And that's kind of the end of the road option. And by that, I mean, there's no going back from being able to get a penile implant, which is basically a surgery where I place a penile prosthesis into the penis. But the nice thing about the implant is then you're not having to worry about things like medications, injections, etc. And on the next slide, there's some pictures, and I'll talk a little bit about what the implant entails. So basically, it's an inflatable device, whereas 3 parts to it. There's cylinders that go into the penis to go into the penile tissue that, if you can see the mouse, that's there right in the middle of the penis. There's 2 cylinders because there's 2 what's called corporal bodies that bring in the blood flow to get you an erection. Then there's the pump that sits down right in between the testicles, down in the scrotum. I tell guys, think of it like a third testicle almost down there at the bottom of the scrotum. And then the third part is that reservoir that the mouse is on, that's placed up over the pubic bone, that sits basically right in this little space between the bladder and the pubic bone. And the idea basically with this procedure is you pump down in the scrotum, about 15 to 20 pumps usually on average, takes about 30 seconds. It brings in fluid from that reservoir into those cylinders. So basically you get an erection just by pumping that pump a few times. You get an erection that feels as natural as a normal erection does. It looks as natural as a normal erection does, and it's as spontaneous as it can get from having an artificial erection, essentially. The important things, the great things about the penile implant is it's totally concealed. No one has to know it's there if you're someone that's having intercourse with someone that's not, a spouse. You can keep the erection for as long as you want. So you can keep the erection for, half an hour, as long as you need to. But most importantly, it doesn't take away from any sensation of the penis. So the sensation of pleasure with intercourse is there, and with orgasm, if you have the ability to orgasm before the procedure or after the procedure, you continue to have that ability with the penile prosthesis, so that none of that sensation aspect of intercourse or orgasm is taken away. Now, the important thing is, after a prostate cancer surgery, usually you are not able to ejaculate at all. So the penile prosthesis doesn't change that aspect. However, you'll still be able to have the feelings of orgasm. And with this procedure, it's actually a pretty straightforward procedure. I make usually an incision that's right underneath the penis, between the penis and the scrotum. That's about 4 centimeters in length. I do the whole procedure, usually in about an hour, maybe an hour and a half, do that one incision. Occasionally, I'll have to make a separate incision up by the pubic bone to place that reservoir. Again, another 4 centimeter incision. And an hour and a half later, you're closed up. And, most of the time, you're able to go home after the procedure. So it's an outpatient procedure. Occasionally, I'll keep you overnight in the hospital in case you have things like heart disease or lung issues, just to make sure that you're doing okay from an anesthesia standpoint. The nice thing is that after that, you're heading home. Now, you do have a catheter for a night, and then oftentimes I'll leave a little drain. But again, those are things that get taken out the next morning. And so you go home with no hardware after post-op for day 1. And so, that's about it. And so, the inflatable penile prosthesis is this great option, but all those other options are fantastic too. And I think, and it's a process after having a prostate cancer procedure to go through, track your progress, track to see how you're doing, but also to know that there are options every step of the way to be able to regain your sexual function, and importantly, as well as your incontinence. And so, moving forward, there's a bunch of different options that you have. There's specific websites. There's one called edcure.org from an erectile function standpoint, where you can, again, track it's right there, edcure.org/safety, about basically to assess where you're at and see how things are going. And oftentimes we have guys that do that over time to see where you were at after the surgery and see where you're at maybe a few months or a year down the road. And again, edcure.org is where that's at. It's a great resource that I actually give out to my patients quite often.
Wonderful. Well, that was phenomenal, Dr. Azam. Thank you so much for sharing that, as well. I thought that was it's nice to give people hope, right? I think after, prostate cancer, obviously everybody's thankful they survived the cancer. It's great news and your PSA is fine, but you feel like a piece of you is missing when you can't have intimate relations with your partner, or you can't, spend time with your friends. You can't go golfing because you're worried about leakage. So it's nice that we can kind of give people those options, for sure. Wonderful. Good. Good. So I guess these are kind of frequently asked questions. So, like we were saying, after surgery, how long does it take to get your bladder back again? I think, I've been kind of alluding to different types of leakages, but when we're talking about pure leaking when you cough, laugh, or sneeze, stress incontinence, you usually expect at least a year. So after about a year, things will plateau. But even after a year, you'll have men who still have ongoing issues with leakage. And then some men, they have surgery, but they still need something afterwards, like radiation for the cancer. Though that combination can significantly impact recovery, and it can also set somebody back to the point where they may still get worsening leakage down the road as well. So it is kind of a moving target, and it's something when you see a urologist, regardless of what their specialty or their subspecialty is always just let them know, hey, I'm leaking urine or I have erectile issues, and they may not feel comfortable offering these options, but there are urologists who can do that, for sure.
So then, the next question, why don't all men recover erectile function after treatment? The issue with, the prostate cancer surgery, like we talked about, is those nerves that run next to the prostate, with a little bit of manipulation, they can take a bit of a hit. And the things, like we talked about, the things that put a patient at an increased risk of having issues with recovering the erectile function are if they had issues with erectile function prior to the procedure. And those things that can put you at a higher risk of having erectile dysfunction preoperatively are things like age, diabetes, high blood pressure, high cholesterol, overall inactivity, but also, the obvious things that your doctor always tells you to stop doing, like eating unhealthy, cigarette smoking, things of that nature. And so it's important to note that, your erectile function, or the potential to regain the erectile function, really can have a high basis off of how you were doing preoperatively. There's a question about shockwave therapy or ultrasound shockwave to the penis for erectile dysfunction. The issue with that therapy, it's a newer therapy, and in medicine, a new therapy is usually, if something's been around for, 10 years or less. Shockwave isn't that new. However, there's not a whole lot of long-term data on shockwave therapy, at least yet at this point. We know what it can do for a couple of years or maybe 5 years afterwards. The problem, though, is with shockwave therapy, the patients that we know based on the data that have some success with it are those patients that have some response to oral therapy, meaning, Cialis, Viagra, things of that nature. It's usually patients that are having some erectile function, but they just want a little bit more rigidity or a little bit more maintenance of the erections that see results. It's very uncommon for a patient after prostate cancer surgery to have any effect or any positive segue with their erectile function. So usually when a guy comes into my clinic and asks about shockwave therapy, based on the data and based on previous experience, I actually do not recommend shockwave therapy because it's expensive. It's unlikely to get you a whole lot of response. However, if you are a guy that's having a decent response with erectile function from just oral medications, it may be worthwhile, but usually after prostate cancer surgery, I don't recommend it, mainly because it may not do a whole lot. It's not a whole lot of bang for your buck, I guess, if you will. And then the last question over here, are penile implants covered by insurance? Long story short, yes. Most insurers, private insurance, Medicare in particular, do cover coverage. It sometimes just varies where where you're at, what surgery center, but it's important to note that it's almost always, I haven't had very many issues with getting the implant covered by my patients. And so it's something that's covered, and that's not something a lot of guys have to worry about, which is wonderful.
Good. Let's see where we're on our next slide here.
And actually, real quick, there's a question about ED and urinary incontinence. So these treatment options absolutely apply to someone that hasn't had prostate cancer that has erectile dysfunction as well, in terms of the treatment options, including the medications for erectile function, the vacuum, the injections, and the implant, and same with the things that Dr. Zaid had talked about from a incontinence standpoint in terms of the pelvic floor therapy, the mesh, and the AUS procedure.
Absolutely, 100%. And that's, where Dr. Levin and I, we have this great, handle where we can help with benign urologic male issues as well, too. I saw a man who had a surgery for an enlarged prostate, and unfortunately, things went a little awry, and he leaks urine afterwards. So these same therapies can be utilized in that sphere too, as well. Excellent, good. And obviously, like I said, for me, like some of the AUS folks are just the happiest people you'll meet, as well. And obviously, it's a very rewarding surgery because you can get people their quality of life back, which I think is kind of the reason why I went into urology, was to be able to kind of help kind of pick the pieces back up again. So that's kind of what I like to do. Wonderful.
So at this time, I'd like to introduce Cliff Pollock. Speaking of real people, real patients, we'll go over his experience treating his prostate cancer and then addressing the erectile dysfunction that followed.
Well, good evening, everyone. As Mike said, I am a prostate cancer survivor. But when I was 58 years old, I was diagnosed with prostate cancer. And even though there was just one little spot in, excuse me, that they did the scan on, I decided to have the prostate removed. After I had the prostate removed, I did have a little time with incontinence, but that actually passed in about 4 months. But I ended up with ED and went back to my regular doctor and asked him, what do I do? And he said, okay, I'm going to put you on Viagra. Well, I took the Viagra and nothing happened except I got miserable headaches. And these headaches just were incapacitating me. So they gave me Cialis, they put me on Levitra, and it just did not work at all. So after I'd say about almost 9 months of that, we did go to the external vacuum device. The external vacuum device does work. It will give you an erection, and that little pressure band that's put on is not the greatest thing in the world to take off, but it does give you an erection. Problem is, it's not very spontaneous. That's number one. Number two, it seems that when you have the band on, your penis becomes a little blue and it gets a little cold. And actually, it doesn't look very appetizing, if you want to put it that way. It just does not look normal. So after about 5 months of that, I decided that, we didn't know what else to do. And basically I went into a major depression. Why? Because I had lost my manhood. I could not make love to my wife the way I really needed to be able to. So having sat for then another 1.5 years with nothing, I finally got an invite to a meeting like this, except at that time it was in person. And I learned about the little Muse device, the little pellets. I learned about the injections, and I also learned about the implants. My wife and I talked about it and decided to go with the implant. I had the implant basically the day after my 60th birthday. That was my present to myself. That was actually the best. I shouldn't say that. It's the second best thing I ever did in my life. First one was marrying her. So it actually restored my manhood. It gave me back what I was missing. It brought back the intimacy that we had lost while we weren't having intercourse the way you're supposed to. The healing of it was very simple. I missed work for 2 weeks basically, but I could have gone back to work after a week. After 3 weeks after the surgery, I went back to the physician and they showed me how to use the pump, and I would do it every day. I'd pump it up a few times and release it just to get the feel of it. And about the middle of the 5th week, the physician said, if you're working with it and it's feeling good, go at it, have intercourse. And so we started to have intercourse again. After the 6 weeks, I also went back to working out with the gentlemen that I worked out with all the time at the gym, showered with them, and they had absolutely no idea there's anything inside me because you can't see anything. Plus, you can't see a scar. So it's totally hidden. I've had the first one, my first implant lasted 14 years. And 3 years ago, I had a revision done and I had a new one put in. Another good thing I did, third best thing I ever did. People ask me a bunch of questions about the implant. Like, one of the questions I get the most is, what happens when you go through the airport and you go through the metal detector? The answer is nothing. It doesn't go off because there's minuscule metal in it. The other thing is, if you've ever been through a metal detector, and I have artificial knees, so my metal detector goes off and they take you to a corner and they take this wand. And if you've ever been wanded, they take this wand and run it all over your body and up the inside of your thighs and across your crotch. Silence. That's it. And I will tell you, a couple of times I've been online going through the airport, and I've seen guys who have taken, pills and things like that, and people will pull them out and say, what is this? And you say, hey, you can't take it. It's in an ice case, so I have to keep the stuff cold. This thing is with you all the time. It's as normal as it can be. The other thing people ask me is, well, does it stop you from getting scans like MRIs, CT scans, or any of those? The answer is no. Does it interfere with urination or have anything that's negative if you have any bladder issues, like if you need a cystoscopy? The answer is absolutely no. It has nothing to do with urination or your bladder or anything else. By far, it is the best possible way to be able to regain erections and to be able to regain your manhood. My wife has said, if she did not know that I had an implant, there's no way of telling. It's really that natural. And it is very, very stiff. It is rigid. It is good for any type of intercourse you want to have. The only thing I would say is, if you have a partner, I would suggest, ED, truthfully, is not just a male issue, it's a partner issue. And I would suggest taking the partner with you when you go to see the prosthetic urologist and learn about what's actually going to happen with the surgery and after the surgery, and make them part of it. And like I said, this one has been with me 3 years. I'm 77 years old. If I live another 14 years, I'll have it done again. Simple as that. There's no age restriction on it, just health. So, Mike, I'll turn it back if there's any questions, mostly for the docs, but I'll hang in there if anybody has any questions.
Thank you very much, Cliff. I want to start with a pre-submitted question. So a gentleman asked, he had a prostatectomy a couple years ago, is struggling with erections, and is looking into horny goat's weed, arginine, and some other over-the-counter medication, and wondered if there's any recommendations and any watch-outs when trying to treat ED with some of these over-the-counter options.
Yeah, it's a great question. It's a question that we get quite often. Things, the supplements that you think about, there's also the Tribulus, Terrasteris, that's another one. Ashwagandha is another one, but there's quite a few things that are out there that are marketed towards erectile dysfunction, just in general. Usually what I tell patients is, it's most of these things have quite a bit of data behind them, or studies that show that they're not detrimental to one's health. However, the effectiveness they have on improving erectile dysfunction is I shouldn't say minimal, but it's not significant, in particular in guys that are post prostatectomy. There are quite a bit of data that show that they can somewhat improve erectile function and improve a little bit of rigidity, a little bit of maintenance, but there's also quite a bit of data that shows that essentially that those kinds of supplements aren't significantly beneficial. Long story short, what I usually tell my guys is it's not going to hurt you if you try it and it seems like it's doing well for you, great. But post prostatectomy, it's very unlikely that you're going to get a significant response from them.
Thank you. And there's a question about, I guess, one or both implants. Are there any age restrictions if somebody's interested in getting either a penile implant, visual urinary sphincter, or any of the other options?
Great question, as well. As with any other surgery, there really is no particular age restriction. I think what's critical is overall health, of course, as well, and patient's desire. I mean, we'll do sphincter surgeries on people in their 60s. We'll do them on people in their 90s, as well. So there's no particular age restriction at all. I think what's really important is taking a team approach. As with any other surgery that you're going to consider, getting your primary doctor on board, making sure we optimize any heart issues, lung issues before. If somebody smokes, we really prefer they don't smoke. Just again, we want to set people up for success, right? As when all these little things can help a lot. So. The other question that often pops up is, can you do both at the same time? Like if somebody has ED and urinary incontinence, can you do 2 implants simultaneously? And the cool thing is you can actually. It does make it a longer surgery. And usually, Dr. Ismail and I would kind of tag team it where we'd both work at the same time. We each have our area of expertise where he would focus on the erectile issue and then I would assist him there. And then I would work on the urinary issue and he would assist me there. So you get 2 for 1.5, I guess.
Now, on the subject of both incontinence and erectile dysfunction, are there things like Kegel exercises or other therapies, interventions that people can do to help maybe address or minimize the side effects after they've had radiation therapy or prostatectomy?
Sure. I think when it comes to Kegel exercises, the answer is yes. I think Kegels are great. I think there's a lot to gain from a sexual, urinary, and I guess GI, benefit as well. The most benefit you're going to get is within the first year after a surgery. If you're looking at urinary leakage, some men leak, when they cough, laugh, or sneeze. I think those men will get the most benefit, especially in the first year. After radiation, a lot of men don't leak when they cough, laugh, or sneeze. They leak because they have urgency. When they got to go, they got to go. They have lack of control. And that's, what we call an overactive bladder, urge incontinence. And that's fundamentally due to radiation changes to the bladder on what we call radiation cystitis. It's just the fancy way of saying the radiation kind of causes some collateral damage to the bladder, which lives right where that prostate is. And in that situation, Kegels have a little limited benefit. Sometimes they can actually worsen things if you're making that pelvic floor really tight and you already have a lot of bladder spasticity. In those cases, there's different types of interventions that we can offer people.
And Dr. Zaid, to that end, actually, there's a question about, the gentleman had a prostatectomy 15 years ago, and it sounds like he's having a little climacturia. So with an orgasm, there's a little bit of liquid. So yeah, it's likely urine, to answer that question for you. Basically, the question is, will Kegels help in that situation?
Yeah, usually not so much. So that's a really good point there. So essentially what you're having is a spasm of the bladder, when you're actually orgasming there as well. Again, I do think that there's some role for Kegels. If you do strengthen the pelvic floor, it can help. It doesn't hurt things, but ultimately I do think you may need some multimodal therapy where you can consider medications to help with bladder relaxation sometimes, as, at the time of sexual activity to minimize that leakage of fluid.
So there's a question about prostate cancer and low testosterone. So if somebody has low testosterone levels and they've had their prostate cancer treated, is there anything that they can do, such as hormone replacement therapy or any other options to raise their testosterone and potentially increase their energy?
Yeah, it's a great question. And it's actually quite often that I have some of our prostate cancer, post-prostate cancer therapy treatment patients on testosterone replacement therapy. Now, the important thing to note with these, with with these options is that, we keep a very close eye on the PSA to make sure that there's no potential recurrence of the prostate cancer. So it's actually quite safe to do testosterone replacement therapy as long as the PSAs have been undetectable, meaning as long as there's no signs of prostate cancer recurrence for a certain amount of time afterwards. And that varies depending on how aggressive the prostate cancer was. So for higher risk prostate cancer, I'll oftentimes wait a little bit longer after the treatment to ensure that the PSAs stay undetectable. But after a certain amount of time, again, depending on the risk of the prostate cancer, testosterone replacement therapy with either injections or a gel is actually quite safe, and it's pretty often that I have patients that are on it. Now, there are some supplements that are out there that they won't necessarily increase the testosterone. Those supplements that claim to increase testosterone, they actually just increase nitric oxide or increase energy levels with improving certain things in the body. They don't actually technically improve the testosterone. Oftentimes what happens is it increases energy, which then increases the motivation to do things like walk, exercise, etc., which then in effect increases testosterone. But those supplements, again, aren't really necessarily increasing the testosterone itself, but they'll definitely make you feel better.
Now, is it possible that radiation therapy could impact someone's ability to ejaculate? And if so, can that ability be restored over time?
Yeah, it's a good question, a tough question to answer. Meaning radiation can absolutely affect ejaculatory function. The muscles that control or help with ejaculation, they contract basically to propulse, to send out the ejaculate. And after radiation, those muscles can take a bit of a hit. In combination, also the prostate takes a little bit of a hit as well in terms of its function with radiation. So it's a combination of those muscles not working super well and the prostate not producing as much of that fluid. In terms of treatment, unfortunately, it doesn't always come back. There's certain, medication type treatment options that we have to try and increase the amount of ejaculate or help those muscles to try and contract a bit better. But usually it's pretty difficult to regain ejaculation after radiation treatment. It's something that it's a question we get pretty often, and it's something that we've done a lot of research on and tried to do a lot to try and see if we can restore it, but it's quite difficult, to be totally frank.
There's a question, this for the doctors and for Cliff both. Is there pain, or do you cause damage when you operate either implant? So imagine talking about when you hit the pump on either in the scrotum, if that's maybe painful or potentially causes damage to blood vessels or other things.
I can tell you from a patient standpoint, the pain is really very minimal. When I had the surgery, they sent me home with barbiturates, of course, but I found out that 2 Advils every 4 hours took the sting off everything. The only real pain that I had was very limited, and that was just learning to find the sweet spot when you were using the bulb to make yourself hard to get the erection. You're pressing on your testicular skin, and after about the 4th or 5th time, you do find the sweet spot where all you feel is pressure. In the beginning, you do feel a little pain, but it goes away very fast as soon as that sweet spot is found. So it's definitely worth, I think it's a lot easier than injecting yourself. Not a problem.
That's awesome insight, Cliff. Thank you for sharing that, as well. When it comes to the artificial sphincter, we're not really transecting or cutting any of the tissues. We actually put the cuff around the urethra, so it shouldn't affect any of the erectile bodies that way as well. But so from that perspective, of course, it shouldn't have any impact as well. We can always remove a sphincter, and it would, other than leaving a little bit of scar tissue in the area, it shouldn't have any effect on penile function.
Thank you. So final question here, and I'll put out a last call for questions. So we asked this specific to some complications from radiation therapy related to bleeding to the penis, and if that's something to be concerned about after a certain duration, or or over any duration?
Yeah, so bleeding after radiation. So, I kind of say radiation is kind of the gift that keeps on giving some ways. So what radiation can do is it can cause a lot of changes throughout the body. In the pelvis space, there's not that much space in the pelvis. The prostate was kind of put in a very precarious location. On the very top of the prostate, you have your bladder. Right behind the prostate, you have your rectum. Going right through the prostate, you have your urethra tube that you pee through basically as well. And when you have radiation to that part of your body, any one of these three organ systems can be affected. So some consequences or probably complications is a better term of radiation that you can see is, number one, stricture or scar tissue in the urethra. Number two is it can affect the rectum and give you what's called radiation proctitis. So some men get like fecal urgency or GI symptoms as a result of that. And on the bladder perspective, you can get, again, like the urinary symptoms I alluded to, like urgency and frequency. But then a subset of those men can get what's called hemorrhagic cystitis, which is just a fancy way of saying that radiation has caused a lot of damage to the actual bladder itself. And that's led to bleeding because that entire surface of the bladder has got just like this horrible sunburn that doesn't heal. So it can be pretty profound. Men can bleed a lot as well. Now, the one thing you do have to think about very rarely is blood in the urine can be due to other sources too. So you don't want to just chalk it up to radiation cystitis. It can come from the kidneys. So kidney stones, infections can cause it. But radiation can also lead to secondary cancers too, like bladder cancers and things of that nature. So in the immediate setting, sometimes you may see some bleeding, but if there is prolonged bleeding, we still would treat it like anybody else who comes in with blood in the urine, do a full evaluation, look inside the bladder with a camera called a cystoscopy, probably get a CAT scan to make sure there's no other causes for it. So the answer is yes, it certainly can be associated with the radiation, but on the other hand, there are some scary things that can also cause it too.
And there's a couple. Oh, sorry. I was just gonna say there's I think one more question in the chat that I don't think we answered yet. The question basically is about taking medications, essentially like finasteride, clonazepam, and the effect on erectile function. And the question is, if shockwave therapy can potentially help in these situations versus injections. And so, my short answer to that would be shockwave therapy in general. The situation that I recommend that is if you're having some success with the oral therapies with Viagra or Cialis, and you're interested in something that's going to be non-invasive, meaning something that's not a vacuum pump or injection, but knowing that shockwave may not give you results. It could, but it may not. But also that you're going to be spending a good chunk of change on it. If you're willing to have your wallet take a little bit of a hit with the risk of not having any effect from the treatment, I think it's reasonable to do. There's no complications, there's no side effects, which is the big benefit in that, you can do the shockwave and it may very well give you some potential benefit. But the situation that I would warn patients about is that you spend a bunch of money and don't get results. That situation in particular, it may be worth a shot if you are willing, again, to go through the financial burden of doing the procedure, depending on who you are and where you're at. And then, the cost, usually it varies. It depends on where you go. It can range usually it's about 6 treatments that are 20 minutes each, about a week apart, give or take. It can range from, a total of sometimes $3,000 to $5,000, sometimes even more. It's not cheap by any means. And so, it's something important to note. I hope that answers that question. So then there was one question about bladder relaxation before sexual activity. Real quick though, nitric oxide, again, that's an important part of erectile function, an important part of the pathway to get blood flow to the penis. I actually recommend a supplement called L-citrulline that can increase nitric oxide in patients, patients that are actually on Cialis or Viagra. So the question is nitric oxide, can it help while you're on Cialis or Viagra? And the answer is yes. And usually it's 3 grams. So L-citrulline, 3 grams or 3,000 milligrams daily is usually what I recommend. And so, Dr. Zaid, there's a question about bladder relaxation before sexual activity and what that entails. There's also a question about the percentage of men that become incontinent after prostatectomy. And I think you might have alluded to that earlier, but I'll let you
Sure.
talk.
Yeah. So with regards to bladder relaxation, I think that was in the context of leaking a little bit of urine with orgasming. So basically the mechanism behind that is what's called a bladder spasm. And, bladder spasm is an uncontrolled contraction of the bladder that can present in a lot of different ways. So when we look at it in the context of overactive bladder, that's like that when you gotta go, that urge sensation. When we look at it in urinary leakage sensation, it's, when you are walking to the bathroom, you start leaking urine, or when you go from sit to stand, you start leaking, your hair running water, your hair leaking, you get leaking. And again, that's a bladder spasm. So there's a whole host of different medications and there's different types of drugs with different side effects and different benefits. But what they do is they kind of just diminish that spasticity of the bladder. That's kind of what we mean by bladder relaxation. So in some cases of climacturia or urine leakage at the time of orgasm, you can actually take one of these medicines that can decrease the spasticity of the bladder, and that can often help decrease that leakage as well. And I'm sorry, doctor, is almost a second question.
Just the percentage of times.
Oh, yes, yep. The percentage. Yeah, so, it varies, as well. Now, if you ask a surgeon, they'll say nobody ever leaks, but but that's not entirely true. So, the data is about 8 to 12% have leakage, but the about 5% of men have really severe leakage to the point where they probably need something done. And again, it's all over the spectrum, right? Some men will go through like a light shield or like a very light pad. Some men are using like Depends. Again, it's different. Usually I find the men who need multimodal therapy, meaning they need surgery plus radiation, or they've had radiation then a salvage surgery. Those men tend to have the worst type of leakage because they already have one hit, then they take a major hit again, and that combination is kind of the death kiss from a urinary control perspective.
And then it looks like there's two last questions. So, one question is, if you try the over-the-counter ED treatments, are they safe to take while on Viagra and Cialis? The short answer is it's likely that they're safe. There usually isn't going to be this big drop in blood pressure that you worry about with taking the over-the-counter medications, because for the most part, they're just increasing nitric oxide. They can sometimes cause a little bit of dizziness or something of that nature, so just be aware of that. But usually they are safe to take as long as there's no prescribed medications in those things, which usually there's not, but sometimes you got to be aware, the Blue Chew or some of those pills, there's been some data that it's actually shown that some of them do have a little bit of, sildenafil in them. So just be aware of that. And then the other question, Cliff, it sounds like did a good job of telling you guys that he had a great experience. There's a question about how much the pump costs, because it seems like it's the best avenue. And so again, that pump, it's covered by insurance. And so usually it just depends on what the deductible is and kind of what your insurance, how that plays out. But usually it's a reasonable option from a financial burden standpoint. And it's, again, it'll vary on exactly how much it would be for each patient. And Cliff, if you don't mind weighing in, yeah.
I would just tell you one thing about insurance. It's never good for you as a patient to call the insurance company to find out if it's covered. All the physicians that do implants have people on their staffs that actually work with the insurance companies and will be able to tell you prior to the surgery what, if any, out-of-pocket expenses you're going to have. Because most of the time, the insurance company is going to ask you for a number of what the surgery is, and you have no idea, and they say, we don't cover it. And I think about 99% of all people that I have ever spoken to who have let the doctors take care of it have been covered. I know when I had my first one done, it cost me $50. That was my copay. When I had the second one done, Medicare paid 100%. So, but leave it to the doctor's offices. They work with the insurance companies that they know how to get them to pay.
And there's a question about the radiation cystitis and whether it ever heals up over time. I think when you're looking at radiation, there's usually two peaks when you have problems. The first is when you're undergoing the radiation immediately. That usually is irritated, and then it kind of heals up on its own. Then when we see people as the second peak, well, that's usually years down the road. Those cases, when you start seeing blood in the urine, it's kind of intermittent blood. It doesn't often like spontaneously heal, but there are things that we can do to help somebody, as well. So assuming that there's no active cancer or anything, you can do something called hyperbaric oxygen therapy, which is actually where you sit in this big chamber and they hyperoxygenate your tissues, and that can actually promote the body to heal itself. So in severe cases of hemorrhagic cystitis, that's kind of the avenue that I'll go with to help, men out, as well. Rarely they do need, if it's like an emergency situation where you're bleeding and the bladder is filling up with clots, it can get pretty scary and you can lose a lot of blood in the bladder. You have to do an emergency surgery and go in and try to cauterize, but it's hard because it's not just usually one pumping vessel. It's just kind of bleeding throughout the entire bladder as well. So those are challenging cases, but hyperbaric oxygen is a way that we can help men to kind of help the bladder spontaneously heal if they do have significant bleeding issues.
Thank you very much. Looks like we have run out of questions. Very active and involved group. I'd like to see that. So I think while we're waiting for any last questions to trickle in, I will say that we are recording this. We will send an email out with a link to the webinar recording, in addition to information about both doctors and how you can reach them. So in these final moments, just want to ask Dr. Zaid and Dr. Islam if you have any last comments or thoughts to share with this group.
Well, I think, Cliff, thank you for joining us. I mean, that was awesome. I think your experience speaks more than anything I could probably say, as well. I think the most important thing when you're trying to figure out what to do, just meeting with a doctor who does this just helps, as well, because they'll give you all the little nuances and they'll actually talk to you about different things. And there are things that you may not have thought about, or there's things that we can do to help out. So I just think sitting down and talking never hurts, as well. And we can kind of go from there.
Yeah, I agree completely. There's a lot of urologists that are out there. There's a small amount of us that do these prosthetic procedures, but the ones of us, if that makes sense, the ones of us that do the procedures, we actually all of us offer the non-surgical options as well. So it's not something that is, it's usually not something that we're pushing you towards, but we'll give you what we feel like our recommendation is for what's best for you. Even if that's not surgery, we're happy to recommend those things as well. So, obviously this talk revolves around the surgeries for these procedures, but it's important to come, talk to a urologist to get those options. And again, I've done a couple of these talks with Cliff, and his expertise in this is it's beyond words what he's able to bring to the table. And it's great to have him here because you hear our perspective, but then Cliff having his perspective as a patient is super important for you as a potential patient to know that, guys out there are getting this and they're having good results. But also, Cliff has been through it. Oasis and I have not. And so that's important to note.
Not that you know of, at least.
So several participants have said thank you and complimented that there's a lot of great information shared, and I could not agree more. Cliff, I want to thank you for joining. You always provide so much. Dr. Islam and Dr. Zaid, you guys are a dynamic duo. I appreciated the information. I know everyone else who attended did as well. And really thank you for your advocacy and commitment to men's health education.
Thank you so much.
There's no further questions. We conclude tonight's Men's Health webinar. Again, you will receive an email with a link to this recording and information about both Dr. Zaid and Dr. Islam and their men's health practice. Thank you, everyone. This concludes tonight's webinar.